triage. My name is Mackenzie. I'm the nurse in triage.
Hi, Mackenzie.
How are you feeling?
I think I'm in labor.
Okay, tell me more about that.
I've been contracting like every 5 to 7 minutes for, I don't know, pretty much all day, maybe 6 hours.
Okay. And have they gotten stronger throughout the day?
Yeah, oh yeah.
Okay, and do you still feel your baby move around?
Oh my gosh, yes.
Okay,
so
good.
much. Yeah.
Have you noticed any leaking of fluid?
No, not any more than normal.
Okay, and any bleeding?
No.
Okay, who did you bring with you today?
This is Maddie, my partner.
Hello, Maddie, welcome. So I think what we'll do is we'll put you on the fetal monitor so we can monitor your baby, monitor your contraction pattern. We'll get a set of vitals.
Okay.
And then I'll maybe go grab the midwife and
Great.
come in and kind of see. They'll likely do a vaginal exam and see what your cervix is at. Okay? Is it okay if I put these bands on you?
Oh yeah, do I need to lay down?
No, you could stay. They do have cords on them, but you could stay up. Are you more comfortable when you're up and moving?
Yeah.
Good, yep. As long as we can reach the monitor here, that's just fine.
Okay, should I come over to the bed?
Yeah, or just right here, or if you are more comfortable sitting or laying, whatever works.
Yeah, sitting up should be okay.
Sitting up? Okay, yeah. Go ahead and you can sit down there.
Oh,
Good job.
is it okay if I sit here?
Yes, absolutely.
Oh.
Okay, I'm gonna lift your gown up here to put this band on.
Okay, alright. Oh. I can't believe this is happening. Oh.
Okay.
Okay.
So I'm gonna put 2 different bands on you.
Okay.
I'm gonna lift the gown up here.
Alright.
And it's gonna come around your back.
Okay.
Good, and then I'm gonna hook up this monitor.
Okay. Is this gonna tell you whether I'm in labor?
This is gonna tell me if you're contracting.
Okay.
And when the contractions are happening, that's what this top one is going to do. And then I'm gonna measure your baby's heart rate as well. We'll do this for about 20 minutes.
Okay.
And we'll go from there.
Okay.
Great job breathing. All right, and a second band around you here.
Okay. Oh.
And then we'll take a peek at your baby.
Okay. Everything's okay with my baby.
So far, I haven't put them on the monitor yet, but everything you're describing sounds exactly like maybe you're kind of starting the process to meet this little one.
Okay, alright.
Do you know if you're having a boy or a girl?
No, it's gonna be a surprise.
Well, how exciting. I'll pull this down. Is that okay?
Yeah, thank you.
Great. Ooh. And we'll start to measure our fetal heart rate here. And I'm also going to get a set of vitals on you.
Okay. Does this have to stay on?
No, this will not.
Okay.
This we'll just get a quick blood pressure.
Okay.
And check your temperature. And then we can take it off, okay?
Sounds good.
I'm going to have you briefly pull down your mask so I can check your temperature. Looks good.
Oh.
All right, we'll set off your blood pressure cuff.
Okay.
Great job breathing. What is your plan for pain management during labor?
I'd like to get through this first part, maybe get in the tub, but
Yeah.
eventually epidural.
Okay,
Yeah.
good deal.
She
Good
really
deal.
wants a doula as well.
Okay, yeah. So once we chat with the midwife, and then if it is necessary, we'll call in the doula. So hopefully that they can be here
Okay.
to help you cope with labor.
Yes, that would be
Alright.
really important.
Your blood pressure looks really good. We can
Okay.
take that off.
Wonderful.
Yes. So I'm going to step out. We'll keep you on the monitor for about 20 minutes in total here.
Okay.
If you need me, You can go ahead and just push the red button,
Okay.
and that's your call light. That'll bring me back in, but otherwise I'll go grab the midwife and we'll be back in a little bit.
Okay. Do I need to just stay still for this?
You know, if you want to sit or you can stand, you've got some nice long cords here, so
Okay,
you can kind of
gotcha.
whatever helps you to cope with labor. You go ahead and do that. Okay.
Great, thank you.
Does that sound okay?
Thanks. Okay.
Any other questions from either of you?
I don't think so.
I'll be back.
Thank you. Thank you.
Thanks so much.
Thank you. Oh, I can't believe it.
Hi, Sarah and Maddie.
Hi. Oh.
It's Mary, the midwife.
Oh, I'm so glad you're here.
Aw, I'm so happy to see you guys.
Hi, I'm Dr. Dorset. I'm the OB resident.
Nice to meet you.
Nice to meet you guys as well.
How are you doing?
Oh, I think things are happening.
Yeah, it's very exciting.
Yeah.
I hear you've been having contractions like every 5 minutes or so.
Yeah, for 6 hours, I think.
probably. Yeah, that's really good. And you don't think you've broken your water?
No.
Things moving normally?
Yes, so much.
No vaginal bleeding?
Nope. No.
Sounds good.
Okay.
Should we check in and see what's going on?
Yeah, yeah, that sounds good.
Alright, sounds good. We're gonna get our stuff together.
Okay.
We're gonna lay you back here a little bit.
Have you ever had a cervical exam before?
No.
Okay, so what we'll do here, as Mary gets her gloves on, I'll put your head back.
Okay.
And I'll have you bring your heels up and together, and then let your legs fall open kind of like a butterfly.
Okay.
Try to stay nice and relaxed. Take those deep breaths, kind of breathe through it. Some moms like to wiggle their toes. That sometimes helps with the discomfort.
Okay.
But it'll be temporary, and you're in control. And if you need her to take a pause, you just vocalize that, okay?
Alright.
All right, we'll put you back here.
Okay, so you said heels together.
Yeah, nice and open.
Oh.
Is that okay?
Yeah.
All
Are you having a contraction right now?
I think so.
Okay, let's wait till this one's over, okay?
Feel free to take Maddie's hand if that helps you.
You're doing so good.
I'm just gonna palpate your contraction a little bit.
Okay. Okay.
Ready?
Yeah.
You're gonna feel the back of my hand,
Okay.
my fingers,
Okay.
and a lot of pressure. Good, you're doing so good. Perfect. I'm gonna take my fingers
Good
out.
job,
Is
Sarah.
it okay if Dr. Thorson checks you too?
Yeah.
Okay.
Alright, so same thing. You're going to feel my touch.
Okay.
You're going to feel the coat gel. And then lots of pressure.
Good, you're doing
Good
really
job,
good.
Sarah.
Thank you. Alright, I'm coming in.
Perfect.
Put your head up
So
here.
good.
Discuss a plan.
Is it okay if I put my legs down?
Yes, yes. You're comfort-wise, you're okay in the bed?
Yeah, up is good.
Yeah.
Okay, so you're about 3 centimeters.
Oh no.
60% effaced, -1.
Okay.
Okay, that's all really good.
Okay.
That means you're kind of in early latent labor, okay, which is totally normal. You've done a lot of really good work to get to 3 centimeters. But we're not quite in active labor yet and not quite ready to be admitted.
Okay.
Okay. So I would recommend that you walk around for a couple hours and come back, and then we'll check you again and see how you're doing.
Okay, I think I can do that.
Is there anything else we should be doing?
Just the movement of walking around and kind of swaying and leaning over a little bit.
Okay.
That stuff can really help, okay?
Okay, sounds good.
And I'll have the charge nurse call in the doula.
Okay, great. Perfect. All right, good. Thank you.
Sounds good. All right, we'll see you soon, okay?
Okay. All right.
Thank you. Good job.
At the end of the day.
Great job breathing, Sarah.
Thanks.
It's about 2 hours. How are you doing?
Oh, things are getting way more intense. Baby is moving a lot. And
Definitely stronger.
yeah.
Yeah.
Like 30 minutes ago, I think.
Yeah.
There was some fluid.
Okay.
Yeah.
There's a big gush of fluid.
Yeah.
What color was the fluid?
Just clear.
Yeah.
Yeah.
Okay, any bleeding?
No.
We're waiting. Okay.
Hi there, we haven't met yet. My name's Dr. Thonigal. I'm one of the OB chief residents. I know that you've met my colleague here, Dr. Dorson. I'm just filling in as Mary is occupied with a different patient right now.
Okay.
And from Mackenzie's report, it sounds like a couple of things have changed over the last 2 hours.
Oh yeah.
Can you tell me a little bit about what's going on?
Yeah, so I came in 2 hours ago, and you know things were pretty regular, but Mary told me I was only about 3 centimeters. So we've been walking, and I've been staying active. We had some lunch.
Keep breathing. You're doing a great job.
Great job.
Yeah, things are way more intense now. Like every 2 or 3 minutes. And I think my water broke.
Well, it sounds like things are progressing. And remind me again, who do you have with you for support today?
This is Maddie, my wife.
Nice to meet you, Maddie.
Me too. Hey, and I'm the doula. My name's Diana.
Nice to meet you both.
I'm so glad you're here.
I'm so glad I can be here with you guys today. Thank you.
So there's a couple of things that we need to do to just complete our assessment and see if now is the point where we need to admit you. We do need to see if your bag of water is broken, and to do that we want to do a speculum exam, and this is a sterile exam.
Okay.
And so a speculum exam is never comfortable, even outside of pregnancy and in pregnancy, because there's not as much lubrication in the vagina. It can be a little bit more uncomfortable. But Mackenzie and I and Dr. Dorson will walk you through the exam, okay? And then you're in the driver's seat. So if I'm causing you any pain or discomfort, you just let me know and I'll stop exactly what I'm doing, okay? All right, we're gonna take some time to kind of get you set up for the exam, and then we'll talk you through exactly what we're doing as we're doing it.
Okay.
Okay? And then after that speculum exam, we will want to reassess you to see if your cervix has changed at all from 3 centimeters and go from there.
Okay.
As we're doing that, Dr. Dorson's gonna scan your belly just to make sure that your baby's head down.
Oh, okay.
Okay? You're doing a great job. Just keep breathing here, okay? All right.
Okay, so we're gonna get you in position for that speculum exam. We'll put your head back just like before, and then have you frog leg your legs right before. Okay. Maybe Maddie, you can go ahead and stay right up next to her. Yeah, and maybe we'll have Deanna come up kind of and help you with some breathing exercises as well. Okay.
Okay, I do the same thing that I did before?
Yeah,
Okay.
I'm gonna do the same frog leg.
And I'm gonna bring your head back here.
Okay.
Nice big rest.
Got this.
Is my baby looking okay?
Yes. Yep, your baby looks very reassuring.
Okay.
Okay. Now we're gonna pull down the covers, okay? Keep your legs just like that.
Okay.
Great. Maybe we'll lift them up.
Okay.
Give you a little more privacy. There.
Okay.
Do you mind if I give you a little head massage?
Oh yeah, that sounds really
So
lovely.
Sarah, all I
Okay.
want you to do is just focus on your breathing, okay? I'm gonna talk through exactly what I'm doing. And like I said, if I'm causing you pain, you just tell me to stop and I'll stop, okay?
Okay.
You're gonna feel my touch right now.
Big breath out.
Keep breathing.
Blow it out.
Blow out your contraction.
Great job, Sarah.
You're doing great.
Nice. Very good. Blow it out. Keep going. Nice job.
You let me know when that contraction's gone away.
Okay. Things are easing off, I think.
Okay. Is it okay for me to continue with the exam?
Yeah.
All right. So this is my touch right here. Just feel a little bit of coolness here. This is the pressure of the speculum.
Great job,
Just keep
Sarah.
breathing.
Nice and focused.
I'm opening the speculum just slightly here. Swab. Can you give me a big cough? Okay, great. All right, I'm taking out the speculum now, okay? All done with that portion of the exam. I'm going to take the slide and take a look under the microscope to see if we see any burns, which will tell us if your bag of water's broken, okay?
Okay.
And in the meantime, Dr. Dorson's going to check to make sure your baby's head down.
Okay. And that's from the outside?
Correct. She'll use an ultrasound.
Okay. Awesome.
So I'll lift your gown up a little bit here.
Okay.
And I'm just gonna move the fetal monitor.
Okay.
Do you know what you're having?
No, it's just a surprise. Are you gonna be looking at that right now?
Nope, I'm just gonna be looking to see that the baby's head down, but I always ask so that I don't show you anything you don't want to see.
Okay,
All
sounds
right,
good.
so I'm gonna place this down here,
Okay.
and your baby is head down.
Oh,
Okay.
wonderful. Okay.
Okay. Put that up.
Okay, yeah.
Put your head up a little bit. That's more
Yeah,
comfortable.
sitting up would be really good.
Yes.
All right, Sarah. Well, I have really great news. It does sound like your bag of water is broken. We were
Okay.
able to see the burning crystals under the microscope.
Okay.
And since since the contractions have picked up, we'd like to just check your cervix to see if you're any more dilated than 3 centimeters.
Okay.
Are you comfortable with both myself and Dr. Dorson doing that exam?
Yeah, if that's what you need to do.
All right, great.
So will they get their gloves on? Keep breathing here. Good job.
It's big. It's good.
Nice vocal exam.
Okay.
So you can take a big breath in and just let it out.
You're ready? We'll put your head back again.
Okay, yeah, I think you're right.
Your covers again.
Okay.
Thank you for meeting for Teen Rounds. We have Miss Sarah. She is a 28-year-old G1P0 at 40 weeks and 2 days. She's here for spontaneous labor. Her pregnancy was complicated by anemia and anxiety. On last check, she was found to be 6 centimeters, 100% effaced, and station was at -1. She's laboring unmedicated, and she has a volunteer doula in with her. She's ruptured, and she had clear fluid. Her GBS is negative. She's blood type O positive, and rubella and varicella is immune. She's a BMI of 33.
Okay. What was her hemoglobin on admission?
Her hemoglobin on admission was 9.4.
Okay. And how does baby look on monitor?
Baby looks great on monitor. Baby also was cephalic when we checked on ultrasound.
Okay, so category 1 tracing.
Yes.
Okay, great. Sounds good.
How often is she contracting?
She's contracting every 1 to 2 minutes at this point.
Okay. And what is your plan going forward?
So my plan going forward would be to go ahead and call anesthesia in so that we can get her an epidural at her request. And then we can recheck her in about 2 hours and kind of go from there.
I think she's not quite ready for her epidural yet, but we'll see. She might be ready for it now. We'll see how she's doing.
And do we have an estimated fetal weight?
Estimated fetal weight was found to be 3,400 on weight folds.
All right, sounds good.
Sounds good.
Let's go
Put
see
in.
the patient.
Hi, I'm Dr. Brecky with anesthesia. How are you
Oh,
doing?
thank God. I'm so ready for you to put an epidural in.
Ready for an epidural?
Yeah, yeah, really ready.
Okay. Real quick, we'll go over the risks and benefits of an epidural. So an epidural is a very safe form of anesthesia for both you and for baby. We tell people the risks are small risk of bleeding, bruising, or infection anytime we poke a needle in the skin. There's a very small chance of it, something like nerve damage, very, very small chance. There's about a 1 out of 100 chance you might get a headache afterwards from the placement of the epidural. Those risks okay with you?
Yeah,
If we proceed? Okay.
All right, so when he gets set up, we'll just chat a little bit about how you're going to be positioned, okay? We'll keep Maddie right up next to you.
I'm having a lot of pressure like this.
Okay, so unfortunately, this is how we're going to have you sit up. Just he'll work fast and he'll work through your contractions. Keep doing just what you've been doing with breathing. Take it one at a time. I'm going to program a fluid bolus. It's not uncommon that after the epidural placement, your blood pressure could drop a little bit. And that's when we kind of treat you ahead of time with some fluid. Okay, just breathe through this contraction. Good job. Good job.
Sarah, I'm just going to open up the gown in the back here. Good job.
Good job.
Good job.
Let it away. Ride that wave. Nice
Good job, Sarah. I'm just going to clean off the skin on your back here, Sarah, so it'll be cold cleaning solution back here.
I'm gonna put this pulse ox on your finger and the blood pressure cuff on your arm. That'll go off fairly frequently during this process. Excuse me, Maddie. I'm just gonna sneak in for this. Now, when Dr. Reddy's ready, he's gonna have you kind of hunch over that pillow, kind of like a cooked shrimp. You're gonna push your lower back out, really drop those shoulders and push your lower back out where you, yeah, and really relax your shoulders. Good, yeah. It's not gonna feel like the best posture, but it's the right posture for the epidural placement. You can sit up right now.
Okay.
Yeah, sit up. And you can move around, just don't reach backwards right now, yeah. Some people like to lean onto their partner as long as that's an okay thing and a safe thing for anesthesia.
Okay.
You could do that as well.
Okay.
And like I said, he's just getting his kit set up here, and then he'll proceed forward, but he'll let you know everything that he's doing.
Okay.
So get you nice and relaxed before the next contraction comes. Okay, so big breath in. Big open mouth exhale. Put the shoulders down. Let your arms relax. Nice. Float in the bottom. We're bringing oxygen to the baby. Nice. Just right this way. Take it one at a time. Nice job. Great
job,
breath
Sarah.
in and blow
Good job,
it
Sarah.
out. There you go.
Great job, Sarah.
Nice. So you get that breathing nice and relaxed. There we go. Ride the wave out. Nice job. Good work. That's a nice strong contraction.
Allow you to wiggle around a little bit if you need to.
Okay.
You can still sway your hips a little bit.
Okay.
Good job. Nice job.
Like this.
Okay. Let's see if you can relax and turn that contraction again. Okay, so big inhale. Nice job.
Am I gonna
Very good.
feel all of this?
So Sarah, you'll feel a poke and a burn with the numbing medicine. I'll let you know before I do that.
Okay.
After that, you might feel some weird pressure, but just let me know if anything else hurts after that point, okay?
Keep working hard, Sarah. You're doing great.
Nice job.
Good job, Sarah. Sarah, is it okay if I put a plastic drape up on your back?
Yeah. Yeah.
Nice.
Oh.
Full plastic drape here, Sarah. Good job.
Great job, Sarah.
So you can relax your eyes, relax your forehead.
Great job.
Good
Nice.
job. You okay if I proceed here, Sarah? So when you're ready, we'll have you get in that bad posture position where you kind of relax your shoulders down, curl forward over baby. Perfect.
Good job, Sarah.
This is just me pressing back here, okay, Sarah? Just pressing.
Nice work,
Good
Sarah.
job, Sarah.
Another contraction.
Okay.
Keep breathing through it.
Now blow it out.
Good job, Sarah. I'll wait until that contraction's done before I proceed.
Nice deep breath. Good.
Good job, Sarah.
Nice job.
You okay if we get started back here, Sarah? Okay. So right where you feel me pressing here, Sarah, is where you feel a poke and a burn with the numbing medicine, okay? So a little poke on 3. 1, 2, 3, poke. Good job, Sarah.
Good job, Sarah.
Burning with the numbing medicine. Good job, Sarah.
You can breathe in some oxygen to the baby. Very good.
Good job, Sarah.
Good job, Sarah.
Now you'll just feel some pressure here, Sarah. Good job.
This is all helping you bring your baby into the world.
Good job, Sarah.
Relax your eyes.
Good job, Sarah. He's just working to find that right spot. You're in a great position.
Good job, Sarah.
Nice job holding still.
Okay, Sarah, I'm in the right spot, so the epidural catheter is going to go in next. Good job.
Am I supposed to feel anything yet?
Nothing yet. It'll take the epidural a few minutes to kick in here. Good job. So the epidural is in, Sarah. You can sit up however is comfortable now. Good job.
That's tough.
So once we get that taped in, we'll get you laying back down and we'll talk about next steps, okay?
Do I have to stay on my back?
Keep
or-
that breathing. So once it's taped in your back, we will still have you reposition in bed. We'll go side to side. I'm actually thinking we'll probably go grab something called a peanut ball if you're willing to try it.
Sure,
It's a big yoga ball that's shaped like a peanut. Really helps to open things up and hopefully let your baby move down towards coming out. But we won't have you stay in the same spot. I think we're going to do a test dose here.
We'll do, yeah, when this contraction's done, we'll do a test
All
dose.
right. Good job, Sarah.
Okay, breathing oxygen, my baby. Great. And relax as much as you can.
Good job, Sarah.
Is that one about done, Sarah?
Oh, yeah.
All right.
Perfect.
Looks like heart rate is 87.
Perfect. So Sarah, you're going to feel cold in your back with this
That's
test
your
dose?
heart rate. Yep. Your baby is good. 145.
Sarah, you'll feel cold in your back. Tell me if you feel anything else funny, like if your heart starts racing, metallic taste in your mouth, ringing in your ears, or if your legs get heavy and numb all of a sudden, okay? All right, here comes test dose.
Oh, that's weird.
Doing great.
Nice and relaxed.
Any of those weird sensations I was talking about, Sarah?
No.
Perfect. No heart rate change?
Heart rate's 86.
Perfect. So we're all done here, Sarah. I'm going to take this plastic drape off. Sorry about this. Perfect.
And take that deep breath again and set it out. Very good.
All right, we're going to tape this epidural up.
So like we were saying before, once we get that taped in, it's just going to drape over your shoulder here. That's just fine right now. It'll take a few minutes to get set up, okay? Your contractions are going to start to feel like they're getting shorter and shorter and less intense. Ideally, the pain level is likely to get to about a 3 out of 10 or less, okay? So hopefully make them more tolerable for you and get some rest.
Okay, that sounds good.
But yep, we'll still have you move side to side. We might have you sit upright, depending on how you're feeling and how your baby's doing. We might even have you go on your hands and knees.
Okay.
We'll just kind of feel.
Yeah,
All right.
that's what I was hoping to do.
Yeah,
Pushing,
good
I
deal.
think.
Good job. Okay, we're ready to,
Alright.
to lay that
All
down
right.
whenever we're ready.
Got that good and taped in, so I'm gonna have you kick your legs forward.
Okay.
Yep, and we'll take this off just temporarily. Great, and lay on down. Now ideally we'll want you to lay just about on your back, but not
so roll back this way.
Yeah, there you go. Kind of like you're on your back. Good. Lift that head up. And we're going to just roll you a little bit on your side for your baby's sake. So I'm going to Vance push that pillow underneath there. Great job.
How's that feel?
Let
Here, let's
this get good and set up.
sit up. I can adjust your pillow just a little. How's that?
Oh, yeah.
Is that better?
Sit and we'll monitor your blood pressure. As you know, we won't have you get out of bed now that you have this epidural. Okay.
How will I use the bathroom?
Good question. So once it starts to become effective, we'll probably call our urinary catheter team and put a catheter in you to help you with that.
Okay.
Also, we won't have you eat any more food. You can drink. So clear liquids, you could have a popsicle, you could have Jello, something like that. But still feel free to keep drinking fluids.
Oh, okay.
Good job. Having a contraction?
I'm feeling something now, yeah.
Just breathe. Good job. I'm gonna feel the contraction.
Nice big breath in. Nice job. You're doing good work for your baby.
So Sarah, the epidural will take about 15 minutes to set up.
Okay.
Our goal is to get your pain to about a 3 or 4 out of 10 or less. It's pretty normal as you start moving along further and your baby starts moving down lower, you might feel more pain and pressure down lower, and that's
Okay.
normal, but it's a good thing because we want you to know when it's time to push.
Okay.
And
Alright.
if there's
thank
any
you.
issues, just let us know, okay?
Thank you so
Yeah.
much.
Thank you.
I'm gonna put this cuff on you, and someone from Dr. Bradkey's team is gonna stay in here with you, and just monitor your blood pressure after this, okay? Is this alright here?
Yeah. Yeah. Oh. Oh.
And I will peek out and I'll let Mary know that you got the epidural.
Okay.
And I would anticipate our next check to be to check your cervix.
Okay. That sounds good.
Thank you so much. You remember, give me a call if you need me.
Sure.
But I'll be back in shortly.
Okay. Sounds good. Oh, I'm so glad that's over.
Yes.
Nice try. Feel better?
Yeah. Yeah. Yeah.
Hi, looks like you're doing really good. I heard you were feeling a little bit more pressure.
Yeah, she's had a lot of pressure between the contractions and with them.
Okay, sounds good. Well, let's check you again and see where we're at, okay?
And just so you know, this is just another nurse on the floor here. Her name is Lindsay. She's just setting up for delivery since you're feeling a little bit more pressure. She'll also help take care of your baby after delivery, so that way I can stay with you and take care of you.
You think the baby's coming soon?
Hopefully, yeah. That's a good sign that we're feeling that pressure, both with contractions and in between, okay? Good job, Sarah. This one close.
You are doing so good.
So we're going to lift up the covers here, and they're going to do another one of those vaginal exams. And since you have your epidural, it should probably not be quite as uncomfortable as before.
I'm gonna check first, okay? And then we'll go. All right, you might feel the back of my hand again, and my fingers, and then a lot of pressure.
Keep it that nice and breathing.
Good. You're doing so good.
Go ahead.
All right, and then you're gonna feel the same thing. You're gonna feel my hand on the outside, go gel, and then lots of pressure.
Great job, Sarah. Okay.
You are doing fantastic. You're 10 centimeters.
Yay.
Awesome.
That means it's time to push.
100% effaced, 0 station. So we're gonna start pushing.
Exciting.
All right, we're gonna start pushing, okay? So I'm gonna take this sheet away if that's all right with you.
All right.
That way you have a little bit more space to move around.
Okay.
Good job.
So what do I do now? How do I push?
We're gonna show you how, okay?
All right. So sometimes pushing, if you've never done it before, can take a little bit of time to figure out the push.
Okay.
And that's totally okay. So when you start to feel that contraction build up, because you're able to feel the little bit of pressure down there, we'll have you take a deep cleansing breath, fill your lungs, and then you're going to take another breath and you're going to bear down into your bottom, similar to having a bowel movement. You're going to use those same muscles, okay? And you're going to really focus on pushing down towards your rectum versus holding the push in your face, okay? When you take that breath, you're going to hold it in and you're not going to blow it out. So as you hold it in, that's where you're going to get some of your force, okay? Ideally, you're going to push for about 10 seconds, but however long you're able to go is great, because ultimately you need to keep breathing for your baby.
Okay. Is Maddie able to count for me?
Yeah, that's great.
Okay.
And Maddie, do you want to hold one of her legs?
I kind of get woozy, so I think I should probably stay by her
Oh,
head.
great. You stay right there, and you can. Are you comfortable staying on that chair?
Yeah, I can do that. Yeah.
Okay. And then maybe I'll hold one of your legs, and Diana will hold one of your legs.
Sounds good.
Yeah. And ideally, you'll push around 3 times for each contraction, but it's really going to depend upon how long your contraction lasts, okay?
Okay. I'm just not feeling a whole lot. So.
Okay. And that's just fine. I'll be able to feel for your contractions too, and I can kind of help you
Okay.
as to when you should start that push.
Okay.
As your baby moves down, you might feel a little more pressure down there, and that's normal. That's just your baby on its way out, okay?
Okay.
Okay, we're gonna try a couple different positions. So let's start here on your back first.
Okay.
That way you can kind of get the hang of it, and then we'll
Okay.
try some other positions too, okay?
Okay.
Are
Great.
you starting to feel some pressure now?
Yeah, I think so.
Think you
Thanks.
are? Yeah, I feel it.
Yeah.
All right,
Yeah,
we're
I
gonna help
feel-
you with your legs here.
So
Okay.
lift these
And
legs
you're
up for
gonna
you.
try and pull back on your legs as well with your
So
hands.
reach
okay?
around.
Yeah.
Yeah,
this.
great.
Okay.
I'm gonna keep your baby on the monitor here.
Okay.
That's
And really
perfect.
let your knees, fall open. Try to give that baby a lot of space. All right, and take that deep breath, and you can curl up around your baby. Good, and Maddie will count for you.
What should I count to?
Count to 10.
Okay. 1, 2,
Hold that
three,
breath.
So good.
4, 5, 6, 7, 8, 9,
Good
10.
job, and take a breath if you need it. Good job. Good job, Sarah. Yep, and go right back into it.
2,
Let's move that baby down.
5, 6, 7, 8,
Yep, take a breath.
9, 10.
Now try one more time. You got one more push in there?
You're doing
One,
Good job.
That's it.
4, 5, 6, 7, 8, 9, 10.
I don't
Put
think
your
I
legs
did
down in
anything.
between. You did so good. It takes a little while, okay? You're doing so good. Okay, we're gonna try a different position now.
Okay.
Okay, let's try hands and knees, okay? I know you have the
yeah,
epidural.
that was
Yeah, I'm
nice.
just gonna put this right here on you. You'd like to push on your hands and knees? That's your
Yeah,
goal?
yeah.
Great.
That would be awesome.
So I'm gonna just take this monitor off.
Okay.
Just while you turn here, and we'll kind of help you.
Okay.
Because you don't quite have that movement. But we'll be careful with the epidural.
Okay.
We'll have you kind of shift your hips and roll onto your
Oh,
side.
like
There you
this?
go. That'll work. Yep.
Okay.
Good. Yep. And I can help you lift up. Go a little further. Yep. Keep this leg underneath. Great job.
Nice.
Good.
Oh,
There you
nice.
go. Yep. And you
Open
can.
legs, okay?
Okay.
And if
That's
it's
it. Perfect.
more comfortable, you can put your arms up. There you go.
Oh, hi.
There you go. Are you starting to feel a contraction now? Starting to feel
I
that
don't
pressure?
feel as much in this position.
Okay, I'll let you know. I'm not feeling it quite yet, but when it starts to build, we'll have you kind of rock down into that push.
Okay.
Yep. Great. All right. I'm starting to feel it build, so take that deep breath.
Okay.
Good, and push. 1.
2, 3, 4,
Great
5,
job.
Good,
Great
productive push.
job.
Nice job.
9, 10.
Good.
That's
Yep,
it.
long, strong push. Keep going, Sarah. You're doing great.
3, 4,
Let's meet this
5,
little one.
6, 7, 8, 9,
Doing
So
so
good.
good. Hang in there.
Yeah, another one just like that.
2,
Great
3,
job.
4, 5, 6, 7, 8, 9.
You are so strong.
You're doing so
job.
good.
Now, in between those contractions, really try to rest. Do you want Maddie to give you a few ice chips?
Yeah, that would be great. That would be
Take
great.
sips of water. Really try to focus to melt to that bed. Relax. This is your time to rest.
Good. Should we try and push on your side now? Let's see if we can turn
Yeah, take it
this
yeah.
side so we're facing that way.
Yeah.
This way.
Other way.
Okay.
Yes, turn. There we go.
Perfect.
Just be careful of your epidural.
Oh,
There
oh,
you go.
oh, this is pulling.
Here, let me help you.
Oh.
Okay, when you get the contraction on this side, you're gonna pull back on this leg, okay?
Okay.
Oh, do I just do this? Okay.
Yep, just
Yep,
like
and let that leg
okay?
fall nice and open here. Good, that baby
Oh,
to
this is a
move
lot of
here.
pressure here. Oh.
That's good, that's good.
Oh.
Are you feeling the contraction now?
I think so.
Okay, good. Take a big deep breath in. Hold it and push down.
Good.
That's it. Good job.
Everything you got. Nice job, Sarah.
7, 8, 9, 10.
Good.
Awesome. And again.
Deep
Big
breath.
deep breath in. And again.
1,
Good, Sarah. Good work.
4, 5, 6, 7, 8, 9, 10.
One more.
Moving your baby. Nice work.
1,
Yep, rock that baby down.
4,
Long, strong
5,
push. Great job.
8, 9, 10.
And rest.
All right, I'm gonna let your legs rest here, and if it's more comfortable, you can leave it up.
Okay.
Whatever's more comfortable for you.
All right, we're just gonna keep pushing like this for a little while. Sometimes it takes a while to get the baby out, but that's totally normal. You're doing really good.
Okay.
All right, you've been pushing for 2 hours. You're doing so good. We're gonna start getting ready to have a baby, okay?
Yay. Right, I'm gonna take this sheet off here. We'll get rid of that for delivery.
How you feeling? Oh, so good.
Yes, she's doing good. And you desired to do skin to skin right away, correct? Okay, so right before the baby comes out, we'll just lift your gown up so that way we can get him or her right on your chest. Sounds good. Probably won't be able to bring them all the way up to you just because of the cord, but we'll get them as close as we can here. And I'm gonna keep feeling for those contractions, and you let me know. We're gonna put a little drape below you. Alrighty, you feeling that contraction? Let's push.
Let's push, let's do it.
Hold those legs
Take a
open
big deep
here.
breath in, hold it, and push down.
Good, one, that's it. Keep going. 4, 5,
Baby down. Nice work.
That's it, keep going, keep going. Good job.
Good, breathe.
Big deep breath in, and push down again.
Push, nice and strong.
That's
1,
it, that's
2,
it. Keep going, keep going.
5, 6.
Go, go, go. You're doing it. You're doing great.
Doing such a good job.
That's it. One more deep breath in.
Sarah, big strong push.
Hold it and push down. Keep going.
2,
That's it. A little bit more, a little bit more. You can do it. Keep going.
7.
You're bringing your baby in the world.
Good job. That's it. That's it.
Great.
You're
Does the baby
doing
have hair?
fantastic.
Looks like some little.
Right.
That's it.
Good deal. Sarah, you're gonna feel a lot of pressure here as
That's
that
right.
baby gets
Slow, deep
closer to
breaths.
delivery. Great job.
Great. Feel another contraction come in? That's it. All right.
Right,
Give
let's
us another big
push.
push.
Deep breath and push. 2.
All right. You're gonna slow your pushes down now. Just little grunty
Good
pushes.
job. Listen to Mary
That's
here.
it. You're doing perfect.
Great job.
Good job. Little bit more.
And I'm gonna lift up your gown here. Your baby's just about out. I'm gonna get some of these
Perfect. Here it
monitors off
comes.
you.
You're doing so good.
Okay, I'm gonna
That's
check for a
it.
cord. There's a
Cord,
cord.
cord, okay. Got it there.
Alright,
Perfect.
great.
And give us one more big push,
Everything
okay?
you got, Sarah.
That's
Push,
it. You
push,
can do
push,
it.
push. Perfect. Good
Here she
job,
comes.
Sarah.
Good.
Great job. Good deal. Can I have a towel?
That's it. You did so
Good
good.
deal. I got the baby here. You wanna grab a towel? Good deal. I'm gonna put your leg here. Oh, your baby's crying. Great job.
Sounds great.
Good. She sounds great. Crying right now is a great thing. Baby's clearing those lungs. Nice.
Sounding
Stretch
good.
another one out here. Great job. Listen to her.
Awesome.
Great job.
There.
Fabulous. We're just gonna keep her right on your chest.
Perfect. Great. You think we're ready to cut the cord?
Are we at a minute, Lindsay?
Yeah, 1 minute.
Perfect. You want to turn the baby over there a little bit?
Maddie, are you gonna cut the cord?
Sure.
All right, we're gonna flip her over here.
Perfect.
Congratulations, she sounds great.
If you could just cut right in between these two here.
Great job. All right, let's get her on your chest. And lift this up. All righty, let her rest there.
Hand on her head so she doesn't get too cold.
I'm gonna listen to her heart and lungs.
And Mom, I'm just gonna be down here working on getting the placenta out, okay?
Can I help you with
I'm
that?
gonna grab a blue towel.
Okay,
Those
good.
contractions. Just breathe and do it for the four, okay?
All right.
Good. Looks like a gush of blood right here. That's good.
She sounds
You
great.
did so good.
Maddie,
Okay,
did
Mom,
she?
if you could go ahead and please give me a little push.
Great job. That was your
Placenta
placenta.
out.
Placenta at 10:35.
You can start the Pitocin now.
All right.
Just start the Pitocin in your IV to get your uterus to clamp back down.
And Mom, I'm gonna press on your belly here to make sure that that uterus is getting nice and firm.
She's doing okay?
She's doing really good. Yeah.
Her vital signs sound great. We'll continue to listen to those. Does she have a name?
Caroline.
Caroline.
Perfect.
How beautiful.
Cute.
She looks like a perfect size.
Gonna put her little foot right here. Back.
And he gets the cover.
We'll take that.
I can hold it in a half pound.
Just see how close it is.
Okay, Mom, I'm gonna take a look here and see if there's anything that needs to be repaired, okay?
Just breathe through that.
Everything looks great. You did such a good job.
Yeah. All right, we're just gonna get you cleaned up, okay?
Legs down here.
Looks like let's just look in the bag. like we got about 200.
200, okay.
Sounds good.
And then Sarah, I'm just gonna put a little pad under your bottom here. Good. All right. What do you think, guys? Should we see how much she weighs?
Yeah. Hey, Lindsay's gonna take her over to the baby warmer. Maddie, you're welcome to go with, or you can stay here by Sarah.
I can stay here.
Okay, take her good deal. How do you feel, Sarah? It's crazy. She's here. She is. Get you a new gown. I turned off your epidural.
Are you feeling like you need to stop for a second? Start off.
Yeah, I can call for someone to bring that in. We'll see how much she weighs over there.
Tell us right up here.
Okay, I'll be right back.
Oh, perfect size, 7 pounds, 8 ounces.
Wow, you are incredible,
Awesome.
Mama.
We'll just see how long she is real quick, and then we'll get her right back to you guys. Okay, 48 centimeters, 19 inches. That is the perfect size baby.
She's got some
You wanna hold her, Maddie?
out over there.
We'll snuggle up so she stays nice and warm.
Congratulations, you guys.
She
You
looks
did amazing.
perfect. We'll do her vitals in a little bit. But you can
Thank you
snuggle
so
up.
much.
Yes.
Congratulations.
Thank you.
You did such a good job. Congratulations.
Thank you so much.
All right, Sarah, so it looks like baby's kind of kissing around there like she might be hungry. Should we try to feed her? Yeah, okay. Did you take any breastfeeding classes or anything?
Yeah, we did.
Oh, good. Okay, so you probably remember we want to really focus on that cross cradle hold.
Okay.
So you're going to hold her with this arm,
Okay.
and then this one is going to support the breast. So I'll help you get her positioned here.
Okay.
And we want to keep her skin to skin so she stays nice and toasty.
Okay.
So I'll take her.
Okay.
Good. We're going to go tummy to tummy. So this hand is going to go all the way around her, hold her on the back of her head, and then this hand is going to support that breast in like a C shape.
Okay,
Yeah.
like this?
That's right. And then we're just going to kind of, do you mind if I help you?
Yeah, that would be great.
We're just going to kind of tickle her lips there. Oh, and there's a big latch. There she goes.
Oh, okay.
Look at that. She's a pro.
Okay.
How does that feel?
It feels okay. You know,
Okay.
a little uncomfortable, but
Okay. Does it feel like pinching or biting at all?
just a little pinch.
a little
maybe.
pinchy? Okay, well, let's break the seal of her mouth then.
Okay.
And we'll just start her again. So tickle her lips there with the nipple.
Okay.
When she gets that big mouth, kind of plop her right on there.
Okay.
There, that one looks better.
Yeah, that
Oh, look
definitely
at her
feels
go.
different.
Perfect.
Okay.
So things you want to watch for is you want to see how her little ear, when she sucks, she does those quick choppies, and then she does those long sucks, and you see a little ear moving up and down. That's what you want to watch for.
Okay.
So she does those quick choppies to stimulate the breast, and then those longer ones where her ear moves, that's the ones where she's pulling the milk into her mouth, and then
Okay.
you'll hear her swallow.
How do I know she's breathing?
Well, you know, she's a nice term baby, so if she can't breathe, she's going to fight you, and she's going to be mad.
Okay.
So babies have those big triangles next to their nose that helps them breathe when they're snuggled in nice and close. Because you really want her nose and her cheeks right against the breast, just like they are there.
Okay.
Perfect. All right, well, we're just going to let you guys hang out there. So we want her to feed for at least 10 minutes.
Okay.
And, you know, if she kind of pops off and looks like she's done, just put her up on your chest, offer a burp. If she still starts kissing around again, we'll try her on the other side.
Okay, sounds good.
I'm just going to go chart a couple things, and then I'll come back and check on you a little bit. But if you need us before we get back, you push this red button, okay?
Okay, I will. Thank
All
you so
right,
much.
you're welcome. You guys are a good team.
Oh, great.
Thank you.
Yeah.